Artificial Intelligence Doctor. www.abcpharma.net/English. User question. How to see in an electrocardiogram when electrical dyssynchrony translates into mechanical dyssynchrony, where different parts of the heart contract at different times. Claude AI answer. This is an insightful question that bridges electrical and mechanical aspects of cardiac function. While an electrocardiogram, ECG, primarily shows electrical activity, there are indeed ways to infer mechanical dyssynchrony from ECG patterns. However, it's important to note that direct visualization of mechanical dyssynchrony typically requires imaging techniques like echocardiography or cardiac MRI. That said, here's how we can use ECG to gain insights into potential mechanical dyssynchrony. 1. QRS duration and morphology. Prolonged QRS duration, greater than 120 milliseconds, often indicates electrical dyssynchrony, which can lead to mechanical dyssynchrony. Specific QRS morphologies, such as left bundle branch block, LBBB, pattern, are associated with mechanical dyssynchrony. 2. Fragmented QRS complexes. The presence of notches or slurs in the QRS complex can indicate areas of slow conduction, potentially reflecting mechanical dyssynchrony. 3. T-wave morphology. T-wave inversions or abnormal T-wave patterns in specific leads can suggest regional repolarization abnormalities, which may correlate with mechanical dyssynchrony. 4. QT dispersion. Increased variability in QT intervals across different leads can indicate heterogeneity in ventricular repolarization, potentially reflecting mechanical dyssynchrony. 5. Vector cardiography. When available, vector cardiographic analysis can provide insights into the three-dimensional propagation of electrical activity, which may correlate with mechanical activation patterns. 6. PR interval and AV dyssynchrony. A prolonged PR interval can indicate AV dyssynchrony, which may contribute to overall mechanical dyssynchrony. 7. Beat-to-beat variability. Inconsistencies in QRS morphology or duration from beat to beat can suggest variable conduction patterns, potentially reflecting varying mechanical activation sequences. 8. Lead placement and regional information. Analyzing specific lead groups, e.g., septal leads versus lateral leads, can provide information about regional activation delays that may translate to mechanical dyssynchrony. 9. P-wave morphology. While primarily reflecting atrial activity, abnormal P-wave morphology can indicate atrial conduction delays that may contribute to overall cardiac dyssynchrony. 10. RR interval variability. In the context of atrial fibrillation or other arrhythmias, significant RR interval variability can lead to beat-to-beat changes in mechanical synchrony. Limitations and considerations. ECG provides an indirect assessment of mechanical dyssynchrony. The correlation between electrical and mechanical dyssynchrony is not perfect. Some patients with electrical dyssynchrony may not have significant mechanical dyssynchrony, and vice versa. The sensitivity and specificity of ECG for detecting mechanical dyssynchrony are limited compared to imaging techniques. Interpretation requires consideration of the patient's clinical context, including underlying cardiac conditions and presence of conduction disorders. Advanced techniques. High-resolution ECG or signal-averaged ECG can provide more detailed information about ventricular activation patterns. Combining ECG with other modalities, such as seismocardiography or ballistocardiography, can provide additional insights into mechanical events. To definitively assess mechanical dyssynchrony, complementary imaging techniques are typically necessary. Echocardiography with tissue Doppler imaging or speckle tracking. Cardiac MRI with tagged imaging or feature tracking. Nuclear imaging techniques like SPECT or PET. In clinical practice, ECG findings suggestive of dyssynchrony often prompt further evaluation with these imaging modalities to confirm and quantify mechanical dyssynchrony. Understanding the relationship between ECG patterns and mechanical dyssynchrony is an active area of research, with ongoing efforts to develop more sophisticated ECG-based algorithms for detecting and characterizing mechanical dyssynchrony.